Hi, this is Claire Duchesne, and this is my presentation on primary care appointment availability for the College of St. Scholastica for the class HIF 6010 Foundations Health Informatics. So introducing the problem, it's been noted, especially during the pandemic, that there's been an increasing limited appointment availability, lack of appointments for patients, and this results in a decreased quality of care. They are not receiving the care that they deserve or need, and it results in delayed treatment for the patient, which negatively affects their life. However, this isn't just something that is seen within Minnesota or within the United States. With the pandemic of COVID-19, it is seen throughout the world. And this is just one of the ways that we can assess this problem and best help it. So the problem within primary care is with the decreased appointment availability. Sometimes patients are unable to be seen for days or weeks. This becomes extremely challenging, especially if it is an acute or urgent matter where they need to be seen in a much quicker time period. Preventative screening appointment availabilities, colonoscopies and mammograms are booked out months in advance, and the preventative screening appointment times has been delayed, especially with the pandemic, as well as things like lab work and annual lab work that can be used to help assess the patient and best help their needs. There's limited staffing with providers and nursing staff, which makes it increasingly difficult for patients to be seen in a timely manner. So something that we use or patients use in order to set up an appointment is they use smartphones to either call and set up an appointment, or they're able to use it on a patient portal to help with the scheduling. However, it's noted that smartphone and computer usage is currently underused in primary care and patient care area, and that there's a great room for growth and improvement, how technology can be embraced and better utilized within primary care. So the solution to this is using consumer health informatics. Patients are allowed to take part in managing their own care and communicating their needs. They are able to discuss things with their provider and best discuss their health. eHealth will allow for communication amongst the provider teams, the patients, anyone that could be consulted or discussing their care. The systemized nomenclature of medicine clinical terms, or the SNOMED CT, is something that can be used throughout the world as well as within practice of primary care. It's the most comprehensive and precise multilingual health terminology within the world, and it has global standards for health-related terms. We can use health information exchange to create a more efficient and effective patient care. The use of the SNOMED CT allows increased consistency, reliability, and comprehensively produce electronic health information. So the solution to the problem that we are proposing is an increase in number of virtual appointments, such as eHealth, telehealth, or mobile health or mHealth. Increase the ability of patients to play a role within their healthcare and to help be a part of that. So possible concerns or issues that may come up would be privacy information of each patient. The Health Insurance Portability and Accountability Act, or HIPAA, can help best suit the patients and best cover making sure that people who need access to the care can have it, as well as the patient has protected information. There's the covered entity of people are members of the workforce or providers who work in healthcare who have access to the information. So nursing staff, providers, laboratory staff, and then business associates who are not members of the workforce, such as people in IT or within the shredding company who also might have access to the patient information. Some aspects of patient privacy that need to be covered when doing something with telehealth or making these improvements to primary care are making sure they acknowledge the patient privacy, protected health information, and personal identifiers. So making sure that the people who need access to the information have it, but also they're not overly looking into patient charts, or patient identifiers are not shared, such as like patients' addresses or social security numbers, making sure that everything is proposed in the legal and the best way for the patient. And the most important is for their information to remain secure. Another concern with the solution of increasing virtual appointments is the concern of privacy. And so with telehealth, it is able to be presented at, or patients are able to be seen in their private home or in a non-public safe area where their information will not be shared. For those who do not understand technology or do not have a great technology knowledge, it's a possibility for them to be seen within primary care clinic rooms. And that way trained staff can help patients set up their telehealth and have that appointment, that virtual appointment with the provider in a safe manner so that it can be done accurately. Implementing and monitoring. Funding for the project initiation and implementation would occur and stakeholders are involved. And then the next important thing is to pilot a program of telehealth software. Prior to implementing a practice within the primary care, it's important to work through the information and to work through any road bumps that could occur with telehealth or telehealth software, such as TitleCare is one of the softwares that can be used for telehealth, and just working through to make sure staff and patients know how to properly use it, as well as getting all of the getting it figured out in the road bumps of they may need to reevaluate how information is stored or shared, and reevaluate if any improvements need to be made prior to implementing that throughout a corporation. Telehealth, one of the nice things about it is it is not a new practice. It is just underutilized in primary care. A cross-sectional study in 2016 through 2018 analyzed 1.1 or over 1.1 million patients, and the study displays the accessibility and usage of telehealth within the United States, verifying that telehealth is a successful form of patient visits or provider to patient visits. It was an increase in telehealth. There was a 14% increase of patients that would prefer to see a provider virtually rather than in person in a clinic. There are multiple reasons why patients would choose to do this. Some of them can be due to lack of transportation. It could be financial status or issues with insurance companies. And the study showed that there was a wide variety of age and race and rationale on why those 14% chose telehealth as their primary form of primary care. And the study did a great job of just implementing and showing how telehealth can be used in a manner that best helps the patients. It also was noted that Something that helps with it is scheduling. So an open access model within scheduling allows for slotted appointments such as same day visits or post hospital visits. This allows for the schedule to have increments blocked off so that way if people need to be seen in an urgent manner that they're able to do so. It was noted that patients are more satisfied when wait times for primary care appointments are minimal or non-existent. So really ensuring that patients have direct access to communicate and discuss findings with their care team. Conclusion. What have we learned throughout the pandemic? What could we have done? What should we have done? What we should have implemented early on in primary care practice is having a better accessibility for patients to be seen. Patients need the accessibility of receiving care, and often primary care serves as managing the patient early on and managing them properly so that way they do not need to be seen in an urgent or emergent situation. They're able to manage some of those acute and chronic situations and best help the patients. However, with the pandemic this last few years, um, there's been an influx of patients, an influx of those in the hospital. And in order to conserve hospital space and best help with the emergency room wait times, it would be beneficial for patients to be able to be seen and have more accessibility to being seen in primary care. Um, Technology-based methods can improve patient care, and that was something that we could have and should have done earlier on throughout the pandemic, is using patient information and health access to have the patients use their smartphones, have them write in and either be triaged with a nurse, write in and patient portal being able to have them speak directly to their nursing staff who can run protocols to help them best, or to discuss directly with their provider in a way that if they can't get in for an appointment, they can still make medication adjustments or have lab work ordered to best make sure they're properly being managed. Another method was the scheduling that we discussed, the open access model to scheduling. Patients were able to use their online portals to help schedule and make appointments and see availability that their providers may have had. One of the big takeaways on what we should have been doing better in primary care is allowing patients to have access to telehealth and giving patients the information on telehealth, on how to access it, how to use it, and how to best receive care. Telehealth and e-health allow the opportunity for patients to be seen by providers in a different part of the United States. And while there may not be accessibility for appointments with the provider in clinic, they may have openings throughout other providers in the United States that are able to see patients in a timely manner to address any concerns or medical needs that they need at that time. The use of health informatics and the use of storing electronic health records to properly communicate throughout the care teams is something that could have been done, should have been done throughout the pandemic. The main takeaway is that smartphones were underutilized and the use of technology was underutilized in order to provide a more efficient and effective patient care. We need to move forward by using telehealth, by using technology in order to best help the patients that we serve. I hope that you enjoyed this presentation. These are some of my references that I used to form this project. And I hope you learned about the importance of telehealth and the importance of increasing accessibility to primary care appointments. Thank you.